Well, hey, that's your cutaway bloopers. He's good at that too.
So I'm here with Carl Schuessler, who has been regarded as a pioneer in the self-funding world, one of the early Health Rosetta advisors. And I wanted to just ask you a couple of questions about why self-funding for larger employers, and how somebody like you can help bring costs down in a self-funded plan.
So why self-funded for employers?
Mm-hmm.
Self-funding allows you to be what we call an active manager of your health plan instead of if you...
Plan I built's performing well, so I'm going to build more.
Who is that guy?
My clients are a hopeful, and I do like it.
Seriously? I'm trying to do an interview here.
Wow, okay.
So why self-funded for employers? It allows them to control their risk and what we call actively manage their risk. When you self-fund, when you're fully insured with an insurance company, you're letting the insurance company manage your risk, and their incentives are the total inverse opposite of yours. They're interested in buoying their stock price in a fully insured model, so they're not interested in your costs going down. The more the costs go up, the more they make. So when you self-fund, self-funding is not created equal. If you self-fund with a Blue Cross, United, Cigna, Aetna, Humana, or as we say, BUCAs, then you're passively managing risk because you're still letting them, even though you're self-funded. What we like to do is pull people away from that model and do our Fair Cost Health Plan self-funded program, which we consider to be employer-built health care versus insurer-built. So we allow you to fully actively manage it. And Dr. Kendrick, what we do is we build it brick by brick, bringing the best components out in the marketplace that we found all over the world to build it with 16 plus solutions and bricks so that we can actively manage the risk and improve clinical outcomes by also improving financial outcomes for the employer.
Thank you. Now, I'm a primary care guy, and so you can imagine I have a selfish question about that. I want to know how primary care fits into these plans and what kind of a primary care model you use.
Primary care is the most important part. It is, you may remember when we were together this morning, it is the first building block we have in the plan.
Yeah, that's why I asked the question.
Surprise. Yeah. But it is the most important one because you are the quarterback of the whole process. You will help drive where that patient gets care. You will help drive to keep that patient from a specialist visit that was not necessary. You will help drive them from lower cost medications. You will help drive them to the right imaging center or to the right outpatient surgical center if there is a surgery. And you'll have them adhering to their medications. So you guys are the most important component of the health plan, hands down.
I like it. I have one more question for you. The last question is, why is this not already happening? What are the barriers for us to implement these types of solutions across the board? And why isn't it already kind of universal?
Well, it's really important you work with what we would say is a good advisor and not a broker. A broker sells insurance. A broker is generally a 1099 employee of the insurance company, of the BUCA, and their incentives are totally misaligned. They may have higher bonuses tied to the amount of business they have with the BUCA, and so therefore they're not always going to bring the solutions we bring. We're independent because we don't work with the BUCAs, and we build it from the ground up with an independent third-party administrator not related to an insurance company, and we really do employer-built health care. And that's how we get away from it. And what we really think, if you said, hey, sum it up, and which is, I can hardly say hello in less than 5 minutes, but to sum it up and very quickly is leave the passive management world to actively manage your plan. To do that, you have to do employer-built healthcare, leaving the insurer-built healthcare world. And it's really eliminating the middles, as we say. Disintermediating the system, as Dr. Keith Smith likes to say.
Oh, come on, what
getting
is this,
rid
man? What's going on?
Back again?
Singing without a permit. What's that all about, man?
much did he have to drink tonight? Lord of mercy. So anyway, what I was saying. So it's disintermediating the system and getting rid of the insurance companies. So in our model, with folks like you, we've talked about Dr. Lee Gross, we allow you to practice medicine in what I call the love triangle. That's the member, the physician, the pharmacist, everyone's together, and you're not getting interference from the insurance company and the PBM, pharmacy benefit manager program, bilking millions. They're all out of the game. Y'all are running the show.
I like it. Sounds good. Thank you so much.
Thank you for your time. Thanks for all your great work.
Appreciate it.